let me briefly present in about 3-4 minutes. Again, a pleasure to be here. I'm a general surgeon, full-time clinician who has developed as well as a passionate evangelist of technology in healthcare, how the smart use of technology can really improve what we do in healthcare and in medical education. I'm from Venezuela originally, but I've been in the US for many years, which is where I trained. And more and more, I feel that it's necessary for us providers, physicians, clinicians, especially the ones who are a little bit of geek physicians, to be out there telling the story. It's a responsibility for us to really use social media, which I use very frequently and very intensely, especially Twitter and LinkedIn, to tell about the message, because we are on the trenches, we are in the front lines, like they say. We're not in the front lines. In my case, I don't feel like I'm a hero of any kind. I think for me, the heroes are the ones who are in the places that are really being hit hard, the providers that are there, but especially the relatives of those providers who are away from them, especially during this pandemic. I think that we have definitely seen how technology is in a way opening the eyes of a lot of people, especially regulators and administrators. I'm a geek, a surgeon. I'm passionate about technology, and I think that that has been the answer to many questions. I was lucky to be at Singularity University and became a faculty of exponential medicine. That's where I met the creator of Google Glass, and that's when I was able to do that first operation with Google Glass, which was really a simple use of a technology that was new and that was instrumental in improving how I taught my students my perspective during doing a procedure. That took a lot of interest, and we thought that this technology could even be used for example, surgical rounds, and in some way connect the physical world to the digital world, connecting us physicians to anyone out there who could give us help, anyone out there who could be a consultant, using a simple device with connectivity. Also integrating what we did, with the electronic medical record. So the technology is out there, and I always say, it's the smart use of the technology that really can make a difference. We do healthcare, we say, but really what we do is sick care, and we've heard that at the beginning. Sick care because we don't use the tools like we should use the tools. That's why we take the problems, we tackle the problems after the fact, and we need to change that. And I think that technology, in a way, can really improve how we connect with the patients. I think that technology paradoxically can make medicine much more humane. So I think that is really, really important. And in regards to education, we educate patients and future providers for the same way we have been doing it for centuries. The same way we did it before, we still do it. And this is how, using technology, we can improve on how we teach the next generations. I love this picture because it tells about the death teaching the living, but it's really different. I think that today we have the tools to have the technology teach the living. There's no way that we could keep the old ways. We need to change. We need to evolve. It's been a revolution of sorts. And I did this little GIF years ago where you see that technology in a span of 10 years has really radically, exponentially changed from a smartphone that was created in the 70s. I had the chance to meet Marty Cooper last year, a phenomenal guy who was telling me about his experience, to the technology that we have now in our pockets, 2 or 3 smartphones that have an incredible computer power. We have all the tools, and we have seen how we have evolved. We have the connectivity, and we've seen how nowadays we talk about VR and AR and XR and spatial computing, which is sort of the 4th generation of computing. We started with MS-DOS systems that we all connect, to graphic user interfaces that we still use, to the touch interfaces that we still use in most devices nowadays, to now computers that are in our heads. And we see how VR has, in a way, starting to revolutionize how we connect and how we communicate communicate and how we learn. With a device like this, there is the cardboard that has been used in many opportunities to teach students remotely. Now it's a teaching tool in a way, when it was created to be a fun and entertainment tool. VR really can change the way we appreciate the real experiences. It can trick our brains, and it can be a technological tool. This is AR in a very contemporary use. This is a tool to teach social distancing, basically using a simple smartphone. It's an app that was created just a few days ago, and I thought that I would bring it to you. To simulation, simulation to telehealth. COVID in just a few days have radically changed the way we connect and communicate with patients. We've been trying to do telemedicine in a very efficacious way for decades, and now in a span of a few days, COVID-19 just basically radically changed that. And I think that we have a long way to go, and hopefully we don't let this new way of doing things fall behind when the COVID experience, when the COVID pandemic just goes away. Nowadays, I think technology, VR, AR, XR are part of the medical and surgical armamentarium, and we need to make use of that, because 5 billion people in the world, maybe much more because it's an old number, do not have access to safe surgery and affordable surgery, and we need to change that. We need to change that because healthcare is a basic human right. And I'm going to stop it here for now and take it from there. Thank you very much for letting me have the opportunity. I don't hear you, Paul. You're muted, Paul.
Thank you so much, Rafael, for this wonderful conversation.